the flu and I'm worried. I have congestion, sweats, I'm hot and cold, I have a little fever, and I'm worried I could have the swine flu. Is that possible?
That's a really common complaint that I've been seeing a lot. I've been seeing a lot of patients that are worried about swine flu and wanting to know the difference between, do I have regular flu or do I have swine flu? So let's kind of talk a little bit about it. The symptoms you're describing are very typical of both swine flu, or we're now calling it H1N1 flu, or regular flu or influenza that we typically see in the fall and winter and immunize people against. Symptoms are fever, chills, body aches, and you're kind of having some
I have all those, so now I'm scared.
Also cough, runny nose.
Yes.
Sometimes you can have nausea or vomiting, although those are a little bit less typical.
I have my stomach's been kind of queasy.
Yeah, that's very common as well. And so telling the difference between the flu and the swine flu is actually very difficult just by symptoms alone, which is why a lot of people are scared like you are. The best way to tell is for us to take samples. We take a swab and we put it inside your nasal cavity and then we send it to the lab. Right now, the public health laboratories determine whether it's influenza A, and then they send it to the CDC, which is the Centers for Disease Control, to actually test if it's the swine flu or H1N1 flu. But the good news is it seems like this, what we thought could have been a pandemic, is really starting to die down. We've seen very little to no deaths in the United States thus far. And really right now what we need to do with you is treat your symptoms and talk about preventing you from getting sick in the future. What have you been doing so far to help yourself feel better?
Well, I just woke up with it today, so I came to talk to you.
Okay. So things you can do that are really going to help you feel better: making sure that you're drinking plenty of fluids. Warmer room temperature is the best, especially if you have a sore throat, because cold fluids can really irritate that. Making sure that you're taking either Tylenol or another type of anti-inflammatory like Motrin or Advil every 4 to 6 hours will keep down your fever, keep away that yucky feeling that you have when you're sick and the body aches. And then for things like runny nose and cough, there are lots of things that we can do. We can talk about over-the-counter medications that can help you feel better.
Okay.
Now, in terms of preventing you from spreading this to any of your coworkers or friends and family, and preventing you from getting the flu again, things that we should be aware of these all the time, but I think that people are kind of hyper aware lately because of the swine flu scare. Make sure that you're washing your hands very frequently, especially after you sneeze or cough. Always cover your mouth when you sneeze or cough with a tissue and throw the tissue away. If you don't have a tissue, using the upper part of your sleeve is the best way to cover your sneeze or cough. And if you don't have a sink available to wash your hands, using an alcohol-based sanitizer, just keep one of those little things in your pocket, and that can also help you keep yourself sanitized and prevent from spreading to other people.
Okay. And what if I did have the swine flu?
If you did have the swine flu, we have 4 medications that are antiviral medications that are approved in the United States right now, and we found that 2 of those are effective against the swine flu. Those are called Tamiflu, which is a pill that you take 2 times a day for 5 days, and Relenza is the other medication, and that's an inhaler that you inhale 2 puffs 2 times a day for 5 days. So we can use those to treat flu symptoms or swine flu or H1N1 symptoms. So those would be a good choice to help you feel better. They don't always make you feel better instantly, but what they can do is they can reduce the severity of your symptoms and the duration of your symptoms. So those are available treatments for both swine flu and regular old influenza.
And if you do the sample, how long is it going to be till I know what flu it is that I have?
Now, finding out if it's influenza A of the H1N1 variety, they can do that in our public health laboratories, and that takes about 3 days, although now that we have everything going on, there's a little backup in the lab, so it can sometimes take longer. And then after that, they send it to the CDC lab, which is, there's just one in the United States to confirm, so that can take quite some time.
Okay. And obviously I came to see you pretty quick. How long should people wait to come see you when they have flu symptoms?
It's best if we start the antiviral medications within 48 hours of your symptoms starting. So within the first 48 hours is a good time period. We have done studies though that show that even if you start the medicine after 48 hours, you can still receive some benefit. So even if it's been longer than that, it's still a good idea to see your healthcare provider.